What is a diagnosis of exclusion for IBS? Imagine feeling constant stomach discomfort, but every test you undergo comes back normal. That's often how diagnosing irritable bowel syndrome begins. It's a process of ruling out other possible causes for your symptoms. When doctors suspect IBS, they first look for signs of other conditions that could explain your issues. These include inflammatory bowel disease, celiac disease, infections, or even colon cancer. To do this, they might order blood tests, stool tests, or imaging scans. If these tests show no signs of other diseases, the doctor then considers IBS as a possible diagnosis. Since irritable bowel syndrome does not have specific biological markers, it's considered a diagnosis based on symptoms. The key symptoms include recurring abdominal pain and changes in bowel habits. The Roman 4 criteria help doctors identify IBS by requiring symptoms like pain that happens at least 1 day a week in the last 3 months. This pain should be linked to bowel movements or changes in how often or how formed your stool is. The symptoms must have started at least 6 months before diagnosis. During your visit, the doctor will ask about your symptoms and perform a physical exam. They will look for warning signs called alarm features. These include blood in stool, unexplained weight loss, anemia, fever, or a family history of gastrointestinal cancers. If these alarm signs are present, further testing is needed to rule out more serious conditions. If there are no warning signs and you meet the symptom criteria, the doctor can confidently diagnose IBS without extensive testing. In some cases, minimal tests are done to confirm the diagnosis or to check for other issues. These tests are targeted and only done if symptoms or history suggest other diseases. This approach helps avoid unnecessary procedures and reduces patient worry. Once diagnosed, doctors classify IBS into subtypes based on bowel habits. These include constipation predominant, diarrhea predominant, mixed, or unclassified. This classification helps guide treatment options. Today, doctors focus on a positive diagnosis based on symptoms and clinical evaluation. They reserve more tests for cases with unusual or severe symptoms. This way, patients get quicker relief and avoid unnecessary procedures. So, in essence, a diagnosis of exclusion for IBS means ruling out other diseases first, then making a diagnosis based on your symptoms and clinical signs.